neuromotor, or sometimes called neuromuscular training, is a really important component, especially for people who are special populations or older adults. So this is balance, coordination, agility, functional fitness training. So a lot of you are probably really familiar this for athletes to improve agility and muscle strength and balance, but it is really important for older adults, because if they have good balance and agility, that's going to lessen their risk of falls, and it's also going to lessen their fear of falling. So there's more detail in the ACSM guidelines, chapter 8. So it is really important, if you're going to work with older populations, to be able to do some neuromotor training with them. So if you look at the ACSM guidelines here on table 7.8, we've got FITT VPP. So neuromotor training, minimum of 2 to 3 days a week is recommended. So there's no real intensity. It's more so that they're going to do these types of skills: balance, agility, coordination. And if you look at the time, 20 to 30 minutes. So this is not very time intensive. So 20 minutes is not a lot of time. So motor skills, and if you look at some of the type, Tai Chi, yoga, other types of balance training, very effective. And, you know, you're probably going to get a better effect in older adults, but of course, if you need to have balance training for sport-specific training, so if you've got somebody who's in, say, boxing or MMA, balance is important. So they don't have a lot of research. You can see there really isn't a whole lot that we know about the actual volume, the pattern, and the progression. It's more so that we want people to continuously do it. We'll talk about this more with our older adult classes, but there are balance training curriculums that you can use. There are different programs. So like an 8-week curriculum they use at Westminster Towers called Fall Proof. So they're out there in addition to basic Tai Chi and yoga classes for seniors. So that is really going to help. So you are going to have to you know, consider that if you're working with especially older populations. So what do you need to know? Well, you really need to know all those ACSM recommendations. So know the recommendations: frequency, intensity, time, type, volume, progression, pattern, all of those for aerobic training, resistance training, flexibility training, and neuromotor training. So know the minimum frequencies, know the intensities. So you need to have those in your head. If you ever want to take the certification, you have to know those. Fatigue, you know, we have to worry about fatigue. You know, progression. Don't have people do too much too soon. They can sometimes be very motivated, but they can, you know, get tired. They can increase their risk of injury. You want to be sure that they have some rest days built in. Soreness is probably going to happen. We don't want to cause excessive soreness, but it's very unlikely that someone's going to start a new exercise program and not have at least a small degree of muscle soreness. So the acute onset muscle soreness, the AOMS, that's your lactic acid buildup. And you guys know that from Dr. Bauer's class, that disappears in the post-exercise period. We clear out the lactate. The lactate does not stick around. What happens for delayed onset muscle soreness is we have a mechanical event. The actin and myosin cross bridges are torn apart, and that causes an inflammatory process and metabolic event that shows up, you know, 24 to 48 hours later. Do worry about pain. You know, some exercises are not going to be comfortable. If people are saying, I'm having pain in my muscles, you know, that seems to go beyond delayed onset muscle soreness, that they've got joint problems, or especially if they're having chest pain, we really need to know about that. People can get injured. We talked about that the other day, that, you know, if they're not active, if they've got poor fitness, if they've got old shoes, they really need to try to get some new shoes. You know, if they're overweight, the ground reaction forces with walking about 1 time your body weight, but if people start getting into higher impact activities, just like some people from the Y want to join the Couch to 5K program and start running, you know, they're at risk of injury just because of the pounding from 2 to 3 times their body weight. So you need to keep aware of that, and that if people try to ramp up and progress too soon, they can get very motivated, but they do have a risk of injury. So we want to progress them in an appropriate way that they're going to improve and not get injured. As we talked about, qualified instructors make the difference. This is what sets you apart from other people in the field. Are people who are very deconditioned going to need supervision? Despite all the work we do between, you know, writing programs and everything, you know, that we can do. You can write the greatest program, people still will not stick with it. You know, do we really know why? You know, is it internal or external motivation? We want to foster that internal motivation. You know, the guidelines book, chapter 11, they have really expanded the behavior modification. You know, what is the mode? Is there a mode mismatch? For example, do you have somebody walking on a treadmill with headphones on when they'd rather be in the pool in a group fitness setting? So is there some sort of disconnect that they're not enjoying the type of exercise that they're doing? If they're very social, maybe something that's a group fitness may be better. If they're a little bit more introverted, maybe doing something by themselves is going to be what they want. Do they want a partner? Do they not have social support? But, you know, we'll talk a lot about the course of the year on behavior modification, because that is really, really important, and knowing your behavior change theories. And of course, do assessments to show progress and improvements. You know, they sometimes forget, you know, that they're actually improving on this. So that's where our skill really makes the difference. So know those guidelines, make sure you've got good leadership and supervision, know how to manipulate the FITT, VPP, and whatever else it is, and an individual approach. People are going to adapt at their own rate. You know, there are some persons with special populations, chronic diseases, some are going to have a much slower progression. There's our poll slide, and then there's the sample question, and we'll go through that in class. So see how much you remember and bring your questions to class, and we will go through them. Thank you.